Chemotherapy. Recognize that generally there is a high level of psychological distress experienced by both the patient and his or her family with chemotherapy administration. Attain an understanding of biohazard safety precautions that's applicable to the particular chemotherapeutic agent that is being administered. Recognize that if an existing chemotherapy infusion appears to be problematic, the appropriate action is going to be immediately to notify the designated RN and/or physician of any problems or interventions. Very important to monitor the patient for any potential problems with chemotherapeutic agents as they're being administered. When you're caring for patients that receive chemotherapy, it's very important to observe the appropriate biohazard safety precautions. Make sure that you place linen that is contaminated with body secretions of patients that have received chemotherapy within the previous 48 hours into a specially marked laundry bag, and then transfer that linen to a labeled impervious bag marked with a distinctive biohazard warning label. People that receive chemotherapy excrete this material in body fluids, and it has to be treated as a contaminant, even more so than just your normal body fluids. With accidental spills, you need to clean up the contaminated area immediately. The individual performing the procedure should wear protective barriers, your gown, your eye shields, and double gloves. You don't want to get the chemotherapy agent on your skin. It can cause some significant issues. Use gauze pads for small spills and clean larger spills with specific absorbent pads. Put the used cleaning materials into a leak-proof, puncture-proof biohazard container and document the incident according to the facility's established protocol. With accidental exposure, contamination of gloves or gowns require immediate removal and discarding according to established protocol. Make sure that you wash your hands after you remove the gloves. And if a cytotoxic drug comes into contact with the skin, you must wash the contaminated area immediately with soap and water. But don't use a scrub brush because it will abrade the skin and allow that cytotoxic agent to enter the body much easier. Flood eyes that have been accidentally exposed to chemotherapy with water or isotonic eye wash for at least 5 minutes. And obtain a medical evaluation as soon as possible to make sure that there is no complication from accidental exposure. Document the incident again according to the facility's established protocol. With waste disposal, all equipment used to administer chemotherapy should be treated as hazardous waste and should be disposed of according to the facility's policy and procedure.